Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with bilateral, really impacted earwax, and you may have noticed this white debris on the surface of the wax. Now that could be one of two things. It could be a fungal infection, so Aspergillus niger, which is the most common strain of fungal infection in the ear. The other one is Candida, and that presents itself more as a thick, creamy discharge. But in fact, these are not fungal spores. This is the cotton wool fibres from a Q-tip, or what we call in the UK cotton bud. Now, this patient actually visited me last year with the exact same problem. They had really impacted earwax, and again, they had used a Q-tip. On this occasion, their right ear, which is the patient felt was the worst of the two, was so painful for him that he attended accident and emergency the other day because they thought they had an infection because it was so painful. When they were assessed, they were advised that there's no infection that's visible at least, but it's just impacted earwax, and it appears as though it's been pushed in. So the patient booked in today. They was very apologetic because obviously I did tell them last time not to poke in the ears, but these things happen and we live and we learn. And it was really uncomfortable for the patient. So I was having to be, I'm always gentle anyway because I don't want to cause any discomfort to my patients, but I was having to be even more so here, I would say, because when you've got impacted wax like this right onto the eardrum, as soon as you make contact like I am now, it's pushing it further against the drum, which is making it a bit more comfortable. So that's why I went in with an ear hook. With the ear hook, I wanted to get into an opening and to yank it out. So it's not a very professional term, but to extract it, should I say. But it just wasn't going to, with the hook, it just sliced through. It wasn't coming out in a big piece. So I've just dosed the ear with some olive oil spray. So the olive oil spray that I use, it's called Clear. You can purchase it from our website, www.clearwax.co.uk. Actually, the web address is on the bottom right of the screen. Visit our shop, and if you look under earwax drops and sprays, you'll see the Clear olive oil spray. If you're a specialist and want to sell these at your clinic, you can register on our website again. There's the web link, select sign in. And then when you register, we've had a few professionals contact us because they said they've not been able to register. Select, you'll have a choice of do you want to register as a member of the public or if you want to register as a professional. So do select professional, and that will give you access to our trade shop. And what the oil does here is just soften this wax a little bit so I can get a better suction grip, which means I don't have to push the suction probe with too much force into the ear to obtain a suction grip. And it's also lubricated the sides of the ear canal wall, which helps to extract the wax. And I'm just trying to tease this gently away. And what was interesting is, although this is their worst ear, the amount of wax in the left ear was significantly more. The difference is, although there's more wax in their better left ear, the right side was impacted furthermore, right up against the eardrum. And you'll see the eardrum in a moment, it was slightly vascularized, so the blood vessels are slightly dilated because the wax is compressed up against it. So I'm just teasing this, little wriggle motions, left to right. And what we noticed afterwards as well, when we examined the wax on the tissue on our medical trolley, is that the exterior, the surface, was really rough, a bit like sandpaper. So that, again, itself can make it a bit uncomfortable as you're extracting the wax. It's rubbing against the side of the ear canal wall, which can be a bit uncomfortable. So we are making slow but steady progress. So I'm just at the top of the ear canal. I'm just trying to loosen this. There we are, and I've just managed to dislodge it. Now that I've dislodged it, I've just got to wriggle it out of the ear. There we are. That's the patient's eardrum. You may have noticed the angle. So the hammer bone, it's the top of the hammer bone is at 9 o'clock, and it's horizontal in plane. Normally the hammer bone is more at 12, 1 o'clock. With that ear, because it was uncomfortable for the patient, that ear was very painful, they were leaning their heads backwards, hence why the angle was slightly different. And quite often when you see surgery videos, that's the view you get, because of course when patients are having surgery, they're laying flat. Normally my patients are just sat upright, normally, with their head in a normal position. But when you watch ear surgeries, you get a different view, similar to the right ear. So this is the left side now. Again, this was really impacted. There's a little gap here, so I just went in with the hook. I've got it into that hole. I'm rotating it, but it's just slicing through like a hot knife through butter. So once again, the hook failed to be effective. And what I'm going to do, I'm just going to work this on the bottom of the ear canal, at the base near the entrance, just where the hairs are. And I'm going to try to lift this off the canal wall, because it's really impacted at the base. And if I can lift this away, then it should hopefully come away in a plug. There we are. You can see it's just behind the hairs. It's similar to like that phrase, pulling a rug under your feet. We're trying to pull the bottom of the wax, which I'm calling the rug part, because it's at the floor, the base. And as you pull that away, or in this case lift it away, it loosens the plug. It mobilises it. And you can see I'm just going to wriggle this out now. I'm just having to go left and right, just trying to wriggle it, tease it through, because it's quite tricky getting it around the bends. There we are, that's one piece. This other plug separated from that piece, because you can see we're having to navigate this around the bend. It's quite a bendy ear. There we are. And that was quite a big piece, you can see. You'll see at the end, I think I've got a still image. Just a bit of oil there, just going to quickly go in just to mop it up a bit. We did drain the ear afterwards as well, just tilted the head in the opposite direction to get some of the excess oil out, but I just suctioned most of it out. And just a bit of soft right at the top. So that plug at the top of the screen, that's from the better ear, the left ear, and the bottom right plug is from the right ear, which is they felt was the worst. I hope you enjoyed that video, guys, and you're all taking care of yourselves and keeping well. Do stay tuned. I've got loads more videos, and speak soon. Bye.